Hi. Hi, everyone. Billy is here with us today on video. He refuses to leave. So we're just going to talk about what we're going to talk about, and he'll join us, right?
Never a dull moment.
Right? Never too early to learn about pelvic floor health and menopause. You know, he can teach his nans and right?
Something I do love about this office, though, is we always have kiddos in here, like of all types of ages. So
it's crazy sometimes.
This is just a really good representation of
what
our lives actually look like.
Exactly.
On a regular basis.
Right. She's never going to have kids. Just teasing. All right. Dr. DeBoer, Rise Chiropractic. If you are first time tuning into our awesome video. So I guess we should still introduce ourselves, right?
And I'm Dr. Krystyna Holland with Inclusive Care.
Good. Do you want to say hi? Hi. Well, we know that his nans will watch this whole video through because he's in it.
Mm-hmm.
Yeah, exactly. All right, guys. So today we're going to chat about menopause and pelvic floor, right? Health and in general. I'm going to kind of let Dr. Krystyna take the lead on this because as much as I adjust menopausal women, I don't, it's not like they're necessarily coming to me because they're having leaking in that time frame or whatnot, but I will definitely ask about it because I know they can be helped, right?
Yeah,
so what do you want to kind of chat about?
So this is one of the things that we've had a lot of questions about recently. We did an in-person workshop and we got some questions there, and then we got some questions on even going back to the very first live that we did on this platform. So I wanted to go ahead and talk about it, and I will tell you, I even learned a lot about when I was looking into menopause, and like I had known about some of the things that happen, but I didn't quite connect them all the way to pelvic floor treatment and like what things are available.
Gotcha.
So that was great. So what we do know about menopause, right, is that it comes with a very large increase in estrogen. And it happens in like the late 40s, early 50s, typically. That is shy of barring any sort of like cancer treatment or if you have a hysterectomy early or anything
that changes the system as it should be, right?
Right.
Yeah.
And so something that was pointed out to me when I was reading, like that became very clear, is that if we're hitting menopause in late 40s and early 50s, that's giving us with like 30 more years of living.
Yeah.
And what's happening right now is that people are having all these symptoms. So a lot of leaking, a lot of pain with sex, a lot of vaginal dryness and itchiness.
Yeah.
And people are just being told like, okay, well, that's just what it's like now.
Right.
Like you're in your 60s or whatever.
Right. You're drying up.
Yeah. Right. It's awful.
It is awful. I mean, if you think about that, like we've talked in our other videos, right? About like postpartumly and stuff like that, about like, is sex painful and stuff like that. And this is just the rest of your life. So you get to that point and it's like you said, you still could have a lot of years of living, right? And that would not be very fun, to say the least.
Yeah.
Another thing I see too is a lot of even older than that women with like bladder prolapse issues is like you hear a lot about and stuff like that too, right?
Yeah.
And we need to sit back.
And so some of that has to do, and that is with or without having a kid before. So even if you're not
that's
postpartum.
right. Yeah, we were talking about that in our pelvic floor workshop, right? What was her name that brought that up? The trainer that was at the pelvic floor. Yeah, that she was saying like that she has clients that are menopause or right there that haven't had kids and are having these issues and stuff like that.
Right.
So that was nice for her to point out because we forget that, you know, and so much is about being postpartum, but it really doesn't have to be the case at all.
Totally. So the reason that happens is that you get this big decrease in estrogen, and that has pretty far-reaching impacts. So one of the things that happens is it decreases the elasticity of a lot of different parts of your body. So it decreases the elasticity of your muscles, decreases the elasticity of your urethra, of your vaginal canal, and of your bladder, actually. So you can you become more sensitive to liquid in your bladder. So that can make you feel like you have to go more often. Because I know that. Yeah,
super cool. Well, not super cool.
Good to know. It's super good to know.
There you go. That might be I'm like super cool. No, not really super cool. But,
insofar as like the pelvic organ prolapse stuff is concerned, what happens is combination of when we age, our muscle size decreases, and then with a big decrease in estrogen, that only contributes further to it.
Yeah.
And so the muscles just aren't strong enough to hold the organs in place. Yeah. Especially if you're not thinking about your pelvic floor, which most people aren't most of the time.
Right. Exactly. So if you're just living life, right? Like you're not thinking about it at all. You're not strengthening it or relaxing it or whatever you need to do, right? So that makes total sense.
Yeah. So the other
we
thing
forget that there's muscles and ligaments there,
right?
You know, like it's just kind of like that thing.
Well, and the ligaments themselves that like hold a lot of that support a lot of those organs can also be impacted by this big decrease in estrogen. The other thing that can happen that can increase leaking is that because the urethra changes like in texture, basically it becomes thinner, the shape changes. Then at the urethral opening where it meets the outside, so the urethra is a long like tube, and where it meets the outside, the change in structure will change the shape. And so it just won't, it's harder for it to stay closed.
Oh, okay. I gotcha. That totally explains it.
Yeah.
Right?
So there's something about the actual form of the urethra that helps maintain continence. And so if that changes, you're more likely to get leaking, especially in addition to this decreased pelvic floor muscle tone, and stuff like that.
Oh, interesting. Wow. Okay. So, any other little tidbits?
I'm trying to think.
I know, right? She's got like a ton of notes. I love it. I'm like, what are all these notes?
So the other thing
is in pink.
It is in pink.
Yeah.
So the other thing that can happen, right, is if you're similar to what can happen at the urethra can also happen in the vaginal canal, which is also a tube, right? And so, and not only the canal itself, but also some of the vulvar tissues with that decrease in estrogen, you can get changes in the tissue structure and the tissue like integrity. So they'll become a lot more fragile is a word that you'll read or hear. They become much more irritated. They become red and irritated and uncomfortable and inflamed. And so then of course, like sex can be painful. The other thing that can be bothersome is you can get like tears in that tissue. So those are things that can really be impacted.
Oh yeah, that does not sound pleasant.
And they can be micro tears, or just like when you get dry skin during the winter, but now it's happening in a place where you really don't want to have dry skin.
Oh,
and
if that cracked skin.
Yeah, exactly.
Oh, yeah,
exactly. And then you're having leaking, right? In addition to that, which is painful and also not really great for like tissue healing.
Okay, so. I mean, what would treatment look like then? Yeah,
so something that people can start doing on their own is one of the things that people tend to do when they start leaking is they want to stop drinking as much water, and that's awful for you.
Yeah, so they're dehydrated.
Right, so they're dehydrated, and also that you get increased bladder irritants, or like an increase really in the how strong those bladder irritants are because it isn't diluted from water. So that can make you have to go more often.
Interesting. I could totally see why you'd back off of it.
Yeah, right. It makes sense why that happens, but it can end up being one of the like worst things you can do. And now you're dealing with dehydration in addition to having to pee all the time, in addition to leaking, in addition to all the other stuff. And especially if you're talking about people in older age, right? Like that can be really damaging and dangerous.
Yeah.
So the other thing that people can do like on their own is to try and limit those bladder irritants. So limiting caffeine, sugary drinks, carbonated beverages, anything that a lot of citrus, all that stuff can irritate the bladder. And that doesn't mean you can never have it. It just means
you're only drinking.
Right. Be aware of that and be aware of the potential implications of drinking those things.
Right.
And then another thing you can do on your own is actually staying sexually active. And that doesn't mean and I should have mentioned this before, like in some of the other videos, whenever we're talking about sex, we're talking about by yourself or with someone else. It doesn't matter. You don't
need to go find a random person.
No.
I mean, you can.
No, but actually, so a recommendation was to use that I was reading was to use a vibrator because it can help to increase blood flow to that area, which is good for healing, good for maintaining tissue integrity, things like that. And the other thing that there actually has been some research on is starting to do Kegels and pelvic floor muscle contractions is super, super helpful for decreasing leaking during menopause. So I read this study that said that pelvic floor physical therapy, including pelvic floor contractions or Kegels or however you want to say it, was decreasing incidence of bladder leakage by 75%.
Oh, wow.
So that's huge, right? That's a huge impact.
And I assume that's doing a correct Kegel.
Right. Yeah. And so there it is, right? Is so many people are doing Kegels and pelvic floor contractions incorrectly, or they might be bearing down instead of sinking coming up, or they may only be, when you do a Kegel, you want to have a squeeze and a lift, and you might only be having the squeeze and not the lift, or you might only be squeezing on the outside and not the inside. Yeah. So just a lot of things to like think about and know, and you can absolutely check yourself, but I do it all the time for a living. So sometimes people just feel better making sure that they're doing it correctly. And I can give them lots of other tools and tricks for things that might be bothersome.
Right. I mean, there's just a lot of times where, like you're describing it, you're like, yeah, I'm doing that. And then you're not really doing it.
Yeah.
Yeah. Or vice versa. Sometimes you might be doing it perfect and you just need that person to say,
to tell
you're doing it good.
Yeah. That's great. Keep doing the thing that you're doing.
Right. I feel in the squeeze and lift.
Yeah. Right. The other thing from a medical management perspective is topical estrogen. So I don't give that out. I can't write a prescription for it, but I do have access to people who can do that. So I'm happy to give a referral for that. And that can go a really far way in improving the healing of the tissues and tissue integrity and all of that. Mm-hmm. There are some concerns about like cancer history. Sometimes that makes people anxious. Yeah. People who prescribe it are definitely going to be better suited to tell you exactly what's going to be good for you and what and your
based
needs.
On your history and what,
but I do know that having a cancer history does not, even if it's breast cancer, does not automatically rule you out from being able to use topical estrogen. So that's good to know.
Yeah, super good to know. And then, so obviously, if they're experiencing any of this stuff, I mean, just to check with a pelvic floor PT would be great, right? Mm-hmm. Like, you're not too far gone. No. Is what I guess I'm trying to say,
no,
right?
You're not.
Just because I know a lot, like, especially when you get to a certain age, a lot of times doctors are just like, well, you're just going to, I know. That's just your life.
And that's what I hate about it, because again, we're talking about 30 years of that.
Right.
And that's just, it's so much. And I just really hate that people are being told like there's nothing you can do.
Yeah.
And the thing about this is that can be super frustrating is it's from a biological stem, right? So there is a reason that it's happening, and that can be really hard, and it can be difficult to find out how to manage. Like some of the other stuff that we've talked about, sometimes you have to seek multiple providers, and you have to kind of really approach the problem from multiple different ways, and it's not just one thing, it's all the things.
Right.
And when you're talking about hormones and things of that nature, like it takes time, and that can also be really frustrating.
Yeah.
So even if introducing, for example, even if topical estrogen is going to really help you, just introducing it isn't going to give you magical overnight results. It's still going to take time, and experimentation and things like that.
Right. And when you're for sure and I mean, there are other, there's bioidentical hormones. Mm-hmm. There's a bunch of different ways to address your hormones, but
absolutely,
in conjunction with a pelvic floor PT to help you strengthen those actual muscles. If it is a true, you need some estrogen or whatnot, there are multiple ways to do that,
right.
And whatever your kind of preferred healthcare method is, there's many ways to address that. A lot of times it's just getting it tested, right, to begin with.
Yeah, it's true.
Stuff like that.
And even if you are on an oral hormone, and doesn't mean that topical estrogen won't still help you. So that's also good to know. And topical estrogen can also be really good, for example, for people who are newly postpartum, who have that big estrogen drop. And then they can have some of the same like tissue changes.
Right.
The duration is different. And so the extent of that change is often different, but it's kind of the same idea.
Super interesting.
Yeah.
All right. Wow. That was great information. I learned a lot. I hope you guys did too. But basically, what she's saying is if you're out there, if you're local, come see her if you're having any issues, obviously. But if not, you can always reach out. Dr. Krystyna knows a lot of pelvic floor PTs all across probably the world, right?
Right.
Anymore with internet. It's always
thank goodness
nice.
for that.
Yeah, exactly. To reach out, and that you don't have to suffer, and that a lot of time, I don't want to say, like you said, I want to say it's easy, but at least you're on the right track, so things can be greatly improved by just changing a few things and just being told how to change those few things, right?
And just a reminder that you're not alone. It's happening to a lot of people. Don't let anyone shame you into getting treatment, or making you feel weird about wanting to have sex into your 60s, 70s, and 80s.
Right.
Good for you if that's what you want to do. There's no requirement for that either, but just know that that's a perfectly fine thing to want to do with your body, and you should be able to do it. And if it's not possible, don't
just maybe don't tell your grandkids.
I'm just teasing. And if you just keep looking for the right people, I hear it all the time that people have been to a lot of providers and there's a lot of frustration, and I have had that experience myself, and I know that that's super challenging. So I just want to again give the recommendation to people to just keep looking for answers, and if there's anything I can do to help, let me know.
Yeah, absolutely. Well, that was great information, you guys. So if you have any other questions, Finn liked it too. Thumbs up from Finn. All right, you guys. So if you have any questions, you can always shoot a PM to either of us, or comment on the video, and we'll definitely get back to you. But that's it. We'll see you guys next week. You want to say bye, Finn?
Bye.
Say goodbye.